Good afternoon. It's Saturday and 4 o'clock, so it must be time for the Senior Moment. This is Connie Clark with Home Helpers, and today I am very honored to have Laura Whalen with me, Director of the Panhandle Health District. And we're going to talk about all the services that they provide. She is the expert on all of that stuff, and let us know what's going on. So welcome.
Thank you, Connie.
I know you all provide home health, but there's a whole array of other services that the Panhandle Health District provides that I wasn't aware until I heard you speak at a Rotary lunch, and I was just totally amazed at all the things that go on in that building up there. Tell us about some of the stuff that you all do.
Absolutely. And Connie, it's not just that building. We actually provide our health services, our health district services, public health services in the 5 northern counties. We are district health department, so we cover Boundary, Bonner, Kootenai, Shoshone, and Benewah counties. The health, and before I started at the health district, I too had no idea what the health district had to offer, and it really is a wide spectrum of things that we do. Very different. I mean, we offer the clinical side of things, environmental health. Our mission, and let me start with that, if you don't mind. It's to protect, promote, and prevent is how I like to put it. We protect the health of our, protect and promote the health of and quality of our environment. We prevent disease, disability, and premature death, and we promote healthy lifestyles. So we have programs that touch on all 3 of those things. Let me just give you a little history of the health district, because I found that fascinating when I first took a job at the health district 10 years ago. I've actually only been in the director role about a year and a half, but I've been with the health district for 10 years. Prior to that, I'm an old Army nurse. I was stationed in Europe, in Germany, for about 6.5 years. Met my husband over there, and I'm originally from Iowa, and had worked in Glacier Park for a couple of summers when I was a kid. I was 18, 19 years old. Fell in love with the mountains and swore that one day I was going to have big sky plates, but I got to potato plates, and I am so thrilled that we landed here in Coeur d'Alene. My husband had actually also worked in Glacier. We didn't meet there; we met in Europe. I mean, this was a natural that we were going to settle in the Northwest. And when I got out of the military, I'm a nurse, and when I got out of the military, I worked in the clinical arena for a few years, primarily at the Veterans Administration Hospital
Over in Spokane,
right? Managing the actually for the bulk of the time managing the rehab, the nursing. We called it the NHCU at the time, the nursing home care unit, and the inpatient hospice. And when this job came open at the health district, it was a division administrator job for the clinical aspect of things. So let me talk about the clinical aspect of things first, and then I'll go into some of our other programs. So I was a division administrator for about 9 years until I took this director. Was asked to take or appointed to take the director position.
Promoted.
I guess that's a good word. So the clinical side of the house, we have clinics, as you might imagine. We have reproductive health clinics where we provide family planning counseling to folks and help them decide, how to space families. We offer immunizations, both adult, for travel and that type of thing. If you happen to be going to, I don't know, pick a spot. If you're going to Africa, you might need some special protection, through, be it typhoid shot, or if you're going to an area that yellow fever is endemic.
And you wouldn't normally think your doctor's office would carry that kind of thing.
No, and generally, some doctor's offices might carry typhoid, maybe not. Very few carry yellow fever because it's very, there's not a huge demand for it. It's kind of expensive to purchase, and there's a special stamp you have to have with it. So generally, they'll refer clients to the health district, and I have some wonderful nurses that will guide you through and make suggestions for how you can best protect yourself with vaccines. And also, of course, vaccines for children. We offer those. One of the neat things that we do on the clinical side of the house is epidemiology, and that is quite unique to public health. I like to call it EPI for short, and I've got a team of nurses and another epidemiologist who follow up on on reportable diseases. Every state has them, and there's usually about somewhere between 70 and 80 reportable diseases in a state. They come, they go. You might one that is still on, but you might remember it a few years back was SARS, the severe acute respiratory disease that just took the nation by storm, or and not just our nation, but many nations. I mean, they shut down a hospital in Toronto, as I recall, and everybody was kind of quarantined in there, and it was scary, and it was added to the reportable disease list, and certainly there was a lot of alarm because we do live in a global world where a lot of travel is done, and how this SARS, or the severe acute respiratory disease, apparently started was just some gentleman in an elevator in the Guangdong province in China touched an elevator button, and whew, the rest is history. But it came and it went, which was good. It caused a lot of illness and some deaths, but it kind of just fizzled out.
So if you go to your local doctor and you get diagnosed with one of these diseases, do they then report that to your district? Is that how you find out?
Right. And the reason, let me just talk a little bit about the reason why diseases are reportable and why public health is interested and is involved in this loop. Because certainly your relationship with your physician is private, and and what the health district has is a relationship with the community. I mean, we want to keep our community healthy, and if a disease is on the reportable disease list, it's been well thought out. The reason it's there, it's because it's very spreadable, and and we want to contain it. We don't want it to spread like wildfire through our community. One of our goals is to keep our community healthy. So let's look at some of these reportable diseases. As you said, say you go to your physicians and you have a disease that's reportable, and it is reported to the health district in a very confidential manner. And what we'll do is we will make sure that all the appropriate medications, the precautions that if anybody who have you, we might give you a ring and say, who have you come into contact with that might need to be treated as well.
So don't be alarmed if you go to your doctor, you have this, and all of a sudden you get a call from the health district.
Right. Certainly your physician would talk to you first and let you know, and hey, you've got, and he's going to be working with you to make sure you're treated for this disease. But the rest of the community, we're going to be working with the rest of the community to make sure that precautions and if say for instance, it's a child and he or she shouldn't be in school, we'll make sure that that doesn't happen, and that if letters need to go out to parents, and I mean, we work with the school district.
So your doctor would treat you, and you would treat the community.
Right. Okay. If need be. I mean, our first ring of defense is to, just make sure that there's a ring around you, and that any contacts that you've had, if this disease is transmittable, which it is, are aware and are taking the approactive precautions for whatever
the
the
whooping
disease.
cough that we were talking
Right, the pertussis.
heard about last year.
Yeah, and we've actually had some pertussis this year, and whooping cough, Connie, is a devastating infection. Before the vaccine was first used in the United States, and that was back in the 1940s, there were about 300,000 cases of whooping cough, which caused about 7,000 deaths in the U.S. every year. I know. And it was mostly in young kids, mostly in children. And now, because we have this vaccine, fewer than 30 children die every year. And they do. I mean, there's kids that die of pertussis or whooping cough. It's the same thing. Times are changing. And I on occasion get a little bit concerned that people become complacent, because if you look at some of these diseases that we have vaccines for, measles, mumps, rubella, diphtheria, they're just not around. Polio. I mean, there's polio. There's people that still remember polio and not being able to go swimming, or not, just being very scared because these diseases are scary. But people are becoming almost complacent maybe my child doesn't need to have all these vaccines.
Well, it wasn't around in their lifetime.
Right. And some, yeah, absolutely. But, I mean, back to pertussis and this nasty little disease. If we look at what's happening with the complacency and with maybe the risk of getting the shot is worse than the risk of getting the disease, and it's not even among educated people. Some people are starting to think this way, and it's scary to me. It's really scary. If you look at there's a small community in Washington in King County called Vashon Island. It's a little commuter island. About 10,000 people live there. They have one elementary, one middle, and one high school. And in that little community of people, and of 10,000, 1 in 7 kids on that island is unvaccinated. I mean, their parents choose not to vaccinate in the elementary school. In middle school, it rises to 1 in 4 kids. There's consequences to choices. And the consequence of this choice to not vaccinate their children first appeared in the early 90s. In 1994, children on that island suffered 48 cases of whooping cough, or pertussis. In 1995, there were 263 reported cases,
Wow.
sick kids. 1999, 458. And this is not just a simple cough. It often starts out kind of benignly, and with a cough and a runny nose, and then the symptoms are why we call it whooping cough. It gives the disease its name. It's the Bordetella pertussis. It's a bacteria that causes. It triggers the accumulation of really thick, sticky, viscous mucus in the windpipe. And kids are trying to cough it out, and they can't get through. They can't get through that sticky, viscous
Right.
mucus, and thus it's so gummy that and when they finally are able to get air through that airway, that's what causes the whoop. It's a long awaited breath that produces that high pitched whoop, if you will. So it's just so important. For parents to be educated and to look at the right websites to talk to because there's a lot of with the internet, there's a lot of different websites out there, and some of them may not contain evidence-based CDC and the American Academy of Pediatrics, these science experts. It may contain other opinions. And some parents choose to believe that, and you see a lot of movie stars perhaps are saying something, and parents will choose to believe movie stars over scientists on occasion. So, are you interested in what the top 5 reportable diseases
Sure.
were in 2011?
And is this for just Kootenai County or the Panhandle?
This is Panhandle Health District. I could give you I could give you Kootenai County. I have all the statistics.
No,
but
we cover all
yeah.
of them. I was just curious as to...
And certainly the bulk of our population is in Kootenai County, so the bulk of our reportable diseases are in Kootenai, but we do have diseases in Benawa, Bonner, Boundary, and Shoshone as well.
So they're not exempt. Okay.
They're not exempt. No, you
So
can't
what-
just cross the border.
So what was the top disease of last year?
Well, and it always has the top billing, this disease, and not just the top billing in Panhandle Health District, but the top billing throughout Idaho, the top billing throughout the United States. And Connie, you know what it is? It's chlamydia. And what I like to tell folks, kids, whoever will listen to me, is that chlamydia is not a flower. It's a sexually transmitted disease, and it's rampant. And the reason that it's a public health concern is because it leads to pelvic inflammatory disease in women, PID, which can lead to infertility. And certainly we want women to be able to have the choice when they're ready to have children, and to be able to bear the children. And chlamydia is very, very treatable. And it's silent sometimes in both men and women. And sometimes not so silent. Sometimes you certainly know there's something wrong. But it's very treatable. So we work on getting it treated and making sure that partners and are treated, and that people understand, how to avoid chlamydia, if you will.
Okay.
Number 2 in North Idaho this year, in calendar year 11 rather, was hepatitis C, which and hepatitis C is a liver affects the liver, as you know, and it's we're concerned about it because it is transmissible through blood and that type of thing. So we want to make sure that that person understands. And a lot of this is just educating the individual that has a disease, what kind of practices they
To
need
keep it from
to keep
spreading.
it from spreading, right?
Okay.
And number 3 in our counties, our 5 counties this last year was pertussis, and we had some in Benoit, and we had an outbreak here in Kootenai as well. And fourth, we had some issues with lead. Primarily that was in Shoshone County with, and primarily in adults. We did have a couple of children, but a total of 4 children, I think, in 2011 who had lead levels above the where we like to, or where where it needs to be, and the rest of them were in adults, folks that maybe work in the mines, and the testing is increased through OSHA mandatory testing, as well as when you're reloading ammunition. You've got to be real cautious of hand washing and making sure that you're...
Interesting.
Yeah, yeah. But our primary concern certainly we don't want anybody to have an elevated lead level, but we certainly don't want children to have elevated lead levels. And we will look at the situation, the household, or, is there paint, or are they living in a place where there's lead in the soil, or they're playing in dirt that's what we call dirty dirt. So we're always concerned about lead. And number 5 was crypto, and no, not a Superman type crypto. It was cryptosporidiosis, and that's a parasitic infection. It's and it can be transmitted fecal to oral, person to person. So hand washing. It also can go animal to person. It's waterborne, foodborne. So and the number. Crypto wasn't a huge number. Our crypto cases. And I have this little sheet, but my eyes are getting bad. We're 38, and the bulk of them being in Kootenai County.
Okay.
This last year.
Very
so that's
interesting.
my little communicable disease story.
Interesting.
Yeah.
And you had mentioned something about environmental. We're going to need to take a break, but you guys do some environmental testing.
Absolutely.
And let's talk about that, because that's something I wasn't aware of
Okay.
till I heard you speak. We're going to take a break, and we will be right back. See, you did good.
So now we're on mute.
Well, he's going to
Oh,
take
he's going
this
to edit
out.
out. Okay, good. Yeah, no, I can talk forever.
Okay, now on the environmental, do you all actually go out and inspect sites, or what is that?
We do a lot of different things with environmental, but yes, on septic tanks and on aquifer protection, the critical materials. A few more things I want to touch on clinically, though, if we have time.
Okay.
But we can jump back and forth.
Yeah, I'd like to try to get as many of your things in there.
And restaurant inspections, that's something that we do.
Right. And I
yeah.
didn't know that. That was
Yeah.
interesting. Okay.
Yeah, and I wanted to get the number of restaurant inspections that we did, too, here.
And they can go on your website and see
Oh, yeah.
their
they can,
favorite restaurant. And
Right.
Okay.
They certainly can.
Because I went and looked at that.
Did you?
Yes, I did.
Was it understandable for you?
Yeah.
Good.
Yeah.
Good.
It was very interesting. I didn't know that that was there. Okay, you ready?
I am.
And we're back. Again, this is Connie Clark with Home Helpers, and we're on the Senior Moment. And we have Laura Whalen, Director of the Panhandle Health District. And we were talking about the clinical side of the health district. And you had mentioned something about lead poisoning being one of the top communicable diseases. And that brought up a point of you all do environmental testing and inspection and that sort of thing. What is that all about?
Our environmental section, certainly we work to promote the protect and promote the health and quality of our environment. A variety of different programs. The lead primarily is in Shoshone County. We have a special program called the Institutional Controls Program that is about testing children for lead in as you know, in the box in the basin, as we call it, up in Shoshone County, is a Superfund site. What our ICP, or Institutional Control Program, does in Shoshone County is works with the community to remediate the soils. So take the dirty dirt, the dirt that's leaded, and replace it with clean dirt. So thus, because you can't replace all the soil, but if you put a good foot of clean dirt, then our community is safe. So, the citizens Shoshone County in the box in the basin, work with our ICP staff up there, and when they dig or if construction happens, certainly we work with the folks up to make sure that there's clean dirt on top of the dirty dirt, if you will.
Okay, clean dirt.
Yeah, right. But the environmental health program is so much more than that. One of the I guess primary functions, or one of the things that the staff does is septic tanks. Do you know if you have a septic tank, or are you on city sewer?
I think I'm on city.
You think, or you know?
I'm in the city of Coeur d'Alene.
Well, then my not just guess, but I know that you are on city sewer.
Okay.
Then. I mean, if you live in a city, if you live within the city limits,
yes.
You're connected to the sewer, which is great. But sometimes you might not be. When I first moved to town, my husband and I, when we were younger then, but the first home we bought was down. It was in Post Falls, but it wasn't. It was in Post Falls. I thought. Our address was Post Falls, but it wasn't really
within the city limits.
Within the city limits, it was in the county, but it's in a neighborhood. And I was young and naive, and didn't work at the health district then, and I just assumed, you flush the toilet, it goes away, and you don't think about it, right? Or you run the dishwasher, the water goes away. You take a shower, the water goes down the drain. But found out we were on a septic tank after we'd bought the home. What silly little home buyers we were that first time so many years ago, which is fine. We learned about the septic tank and how to maintain the septic tank and where it was, and went on from there. But how the health district is involved in septic tank is we permit them. When a new home is constructed, we work with the homeowner on placing the septic tank. Where's it going to go? It has to be a certain distance from the house, a certain distance from, if you're on a well, you don't really want your drain filled and your tank right next to your water well. There's rules about that.
Yeah.
So we permit these septic tanks and go out and look at the soils. And, one of the most fun things I did when I first took the director job is one of my county commissioners up in Boundary County, Commissioner Kirby, who is I very much appreciate all my commissioners, but Commissioner Kirby asked, hey Laura, would you like to go out with one of my pumpers? And I said, well, sure, I think that would be fun. So I spent a day up in Boundary County. And certainly the health district doesn't pump, but we work with pumpers. So I spent a day up in Boundary County with a delightful gentleman, and we went and we pumped 3 or 4 septic tanks out in the woods, and it was quite the experience. And that's where that stuff goes. The solids go into the tank, right? And then everything goes into the tank, but the liquids flow into your drain field. And then the solids kind of stay in the tank, and every once in a while you're going to have that tank pumped, and that's what the pumpers do. So
you all permit when anybody's going to put one in, and then you come back and inspect it.
We don't. We make sure that it's installed correctly, right? As part of the permitting process, correct. There are drain fields that fail sometimes. And we help with that, help them figure out why it failed and where they can put another one. Sometimes, there can be complaints, maybe somebody's drain field is annoying somebody else for some reason, and we'll look at that. But, our idea is to educate and just to make sure, that the water stays safe, that the people stay safe, and people know how to maintain their septic tanks and are, what not to put down your drain. And probably a good idea when you're, for the city sewer as well as septics. But that septic tank is yours pretty much. And you want to make sure that you're not putting coffee grounds or things, cigarette butts, things like that, down your sink or garbage disposal or into your toilet, because that's all going right into your own personal septic tank.
Interesting.
Right. Another program that our environmental health folks do is restaurant inspections. We go into restaurants and inspect Take again, our primary focus is education but to make sure that they understand that they're holding their food at the right temperatures, that they are washing their hands, that they've got plenty of places to wash their hands, that they're wearing gloves when they need to be wearing gloves, that they're cooking their foods to the right temperature, and things like that. That they don't have mice running around, and that they're storing their food correctly. I mean, there's all sorts of things you'd be amazed that's involved in food handling. In fact, these food handlers have to take a little test, which is appropriate. I mean, there's a lot to learn if you're in that role of producing food that is going to be delivered to somebody's plate.
How often do you inspect a restaurant?
They are annual inspections. Certainly, if there's problems, it's with a little more frequency. And most of our restaurants, if there's a problem and we tell them, what the problem is, they correct it right away, and there's not an issue. If you're interested, sometimes before I go out to eat, I'll take a look at the Panhandle Health District website. And look up the restaurant I want to go to, or
Yeah,
that
I've
I
looked
have
at
been
that,
to.
yeah.
Yeah, and it will walk you through their last few inspections and what how did they do? How did they rate?
And you can see exactly if there were any issues, what those issues were.
Right, exactly, and were they able to fix those up?
Interesting.
And I will later give you the website, and you just go to restaurant inspections, and there it is.
And I also see something on here about aquifer.
Right,
What do you all do with that?
our aquifer protection program. We are so fortunate to live over the aquifer. I mean, we have this aquifer that we have here in Kootenai and a little bit in Bonner County. Provides the water, is the sole source aquifer for over 500,000 people, us as well as the folks in Spokane.
Wow.
Right. So this is just water that's just, underneath us, rushing and beautiful, clean, fresh, best water. A lot better than if you're in LA, I tell you, turn the tap on. What we work towards is assuring that water stays clean, stays fresh. I mean, if you look where, a lot of the prairie is over the aquifer, right? And there's a lot of businesses over the aquifer, and some of these businesses might store chemicals or diesel, and we work with those businesses to make sure that they're storing their chemicals over the aquifer so they don't leak into the aquifer.
Very interesting.
Yeah, it is. It is.
Wow. I wasn't aware that you all did all of that. And I see on here you also have, it says Child Care Resource Center. What's that?
I actually used that when I first came to town. Before I worked at the health district. It's a place where you can call and talk to someone about. I was a new mom, and I had to go back to work, and I needed a place to put my dear sweet little Angie, who was just 3 months old, and somebody I could trust. And what this Child Care Resource Center does is talks to those moms and talks to them about what quality is, and gives them a list of daycares that you can go interview. Which is a nice deal. And also what that program does is works with the child care providers, the licensed child care providers, on quality and improving what they're doing. We another component of what we do with licensed child care is we inspect them as well, kind of a regulatory arm, just to make sure that they're storing their chemicals out of reach, that they don't have firearms, that they're following all the rules. And that they've got all the paperwork in order like they're supposed to have.
So if you are planning on or wanting to take your child to a certain child care place, they can call you to find out if they're licensed and all of that kind of?
Right. They can call the CCRC and they can chat with them about that.
Very interesting, very interesting. And you have the WIC program there too.
Right, and that's another program that, had I known about it when I was a brand new mom that had just moved here from Germany and didn't have a job and was pregnant, and my husband and I just had just moved here, but I wasn't aware of the program. Had I been, I would have based on my income and the fact that I was pregnant, and my income being, pretty much nothing at the time, I could have gone to WIC and they would have provided me some nutritional counseling and what should you be eating when you're pregnant, and talk to me about, my plans for breastfeeding, or was I going to use formula, and talk to me about the pros and the cons and the pros of breastfeeding. And they would have provided me with some vouchers for healthy foods, and now healthy foods and vegetables. In calendar year 11, in the 5 northern counties, we provided almost $2.8 million worth of food vouchers that were redeemed at local grocery stores for pregnant women and children under the age of 5 that qualify. There's an income level that they
Right.
need. Right. So it provides just a little bit of extra, milk, cheese, some healthy vegetables, some extra food on the table.
And it goes through the child age of 5.
Right.
Interesting. Because I've heard of the WIC program because my daughter used that because her husband was military. And I remember the formula and that sort of thing, but I didn't realize it went till age 5 of the child.
Right. As long as they stay income eligible, the babies or the children are able to get foods up until they're 5 years old.
Interesting. Very interesting. And you also have on here disaster preparedness. What is that?
We all remember 911. And 911 sparked something in these United States, and it made us sit back and look at, what are we doing to plan, to prepare, not just for terrorist type things, but for natural disasters, for floods, for hurricanes, for huge car accidents, for whatever kind of thing might befall our community. So what we do in our when we're in our preparedness realm or world is work with our community partners, our hospitals, our coroners, our law enforcement, our emergency managers at the county level to prepare for disaster, if you will, and how are we as a county, as 5 counties, going to work together, pool our resources, and make sure that our citizens are taken care of should something happen. So we do exercises, and in mock disasters, planning, that type of thing.
Very interesting, very interesting. And you have another program there that is one of my very most favorites, and that's your Senior Companion program.
Connie, that's one of my favorites too. Every one of those people is gold. What the Senior Companion program does is provides a companion. I mean, the name says it, provides a companion for elderly folks that qualify. To just go sit with them, go do a little grocery shopping with them, provide a little respite, take them on an errand or two, and we provide a small stipend to those volunteers. I mean, it's a win-win. It's a win for the recipient as well as a win for the companion.
And the companions are all seniors themselves.
They are. That's what's. I mean, it's just beautiful. We had a recognition luncheon for them just the other day, and it was just. I can't not smile when I'm with that group.
Yeah, they're a great group, and I'm always sending folks over there to talk to them because a lot of people don't know that service is available, and they think they need to go to an agency to pay for someone to come sit with their spouse that has Alzheimer's and they need to get away for a couple of hours, or they can't drive to the grocery store.
Right.
They think they need to pay for that sort of thing, and your program
is at no
fantastic.
Cost to the
yeah.
no cost to the client. So have them give us a ring. We would be happy to, or if they want to be a senior companion. We're always looking for some good companions, and again, the stipend is small, but the rewards are great.
Yeah, if you're physically able to get up and get around.
And get out of the house.
And you're trying to figure out, what am I going to do all day?
And something else, if you're trying to figure out what to do all day, why not go to a fit and fall proof class? Have you heard about those?
I have, but I didn't know you all had those.
Why, yes, we do. They are, we have a group, again, it's a group of volunteers, and these are non-paid volunteers, but volunteers that that really want to make a difference. And we work with them on how to lead a group of primarily seniors, but you don't have to be seniors. I actually went to one of these classes, and I beat it up a little bit. I got a little sweaty. I mean, they work with they work with bands, and primarily out of a by or out of a chair, and a lot of camaraderie. I think last year we had, like 900 and some folks went to some of these classes. There's lots of different groups in all 5 of our communities. So if you're interested in attending or maybe learning how to be an instructor or how to get a class started, give us a ring.
Oh,
We would-
fantastic. Interesting. Well, we need to take one more break.
Okay.
But when we come back, we're going to talk about some more of the Panhandle Health District. You all just have so many neat services over there. We'll be right back.
Okay. So what else are we going to chit chat about? Smoking cessation. Let's touch on smoking.
Okay.
Oh, and the MRCs. That's part of preparedness again, Medical Reserve Corps.
Well, you tell me. I'm going to depend on you because that was what was on my list.
Okay, yeah, I'll wing it.
Okay.
Let me just put a little line by what we haven't talked about. We've talked about WIC. We need to touch a little bit more about our home health. STDs. I suppose we should talk about STDs. I'm trying to be, respectful of the audience. And our website. I'll give our website.
Perfect. Okay. Let's see. I have to add.
And I could talk about our Board of Health, I guess. I don't know.
Okay. And we're back. This is Connie Clark with Home Helpers, and you're on the Senior Moment. And we have Laura Whalen with the Panhandle Health District. And we've been talking about all the different services that the Health District provides. And all of this is listed on their website, which we're going to give. But a lot of the things that you've just told me during the break, I didn't see on the website. So you need to tell me, what else do you all do over there?
Okay. Well, we were talking about preparedness just a moment ago, and one of the things I should mention is our Medical Reserve Corps, our MRC folks, who are a group of medical and non-medical people that have signed up and come to, a little bit of education that we offer. And if there is an emergency, and these are, there's a lot of doctors and nurses and providers, as well as folks that are not medical, that are willing to volunteer in their capacity if we do have an emergency that would require or call for those services. So again, another opportunity if you are looking for a way to help your community. Give us a call and we can tell you all about the Medical Reserve Corps. Our clinical, we talked a little bit about our clinics, our immunization and our reproductive health clinics. We also offer STD, sexually transmitted disease, testing and treatment. Certainly, if you are interested in what your HIV status is, we have confidential testing that is very simple through just a finger stick. And do we have HIV in North Idaho? Connie, yes, we do. So it is, it's everybody should know their status and be cautious.
You can't get away from it.
No. Smoking, I wanted to talk a little bit about our smoking cessation. We have smoking, we work to prevent people from starting smoking, certainly, and we help people quit. If you're interested in taking some smoking cessation classes or even some one-on-one, we've got a staff member that can help you do that. Smoking is bad, and certainly a success that we had this year in working with our policymakers was banning the sale of electronic cigarettes to minors, just to minors. In all of Idaho, which is fantastic, and that started with our Board of Health here in North Idaho. I'm thrilled, and our cities were jumping on board. But how much easier to facilitate if the whole state took this on, and They did. Representative Nonini carried it through the House and Senator Hammond through the Senate, and it passed unanimously in both. And I don't know if you know. Do you know what electronic cigarettes are?
I have seen them.
And
And that was probably a loophole that the minors were able to get under because technically it's not a cigarette.
It's not, because it
You
doesn't
know?
contain tobacco.
Right.
What it contains, though, Connie, is nicotine. And nicotine is, it's more addictive than heroin. Is what some of the literature points to. It's very addictive. So that's the piece in the cigarette that gets the kids hooked. And nicotine is not good for you. And what these electronic cigarettes contain is, and they're not regulated. Currently, they're not regulated, and that's how they kind of got under the wire. And they
Right.
were selling them in the malls, to kids. I mean, I was with a child that was under 18 at one point in time, and one of these little mall fellas, this is before the law passed, approached this child and said, "Hey, look, this is great. It tastes like bubble gum," and blew the vapor. It's a new term. They call it vaping instead of smoking because it's a vapor. And I mean, it's a no-brainer. Nicotine should not be in the hands of minors. So kudos to our state legislature for getting this through. And because this is not regulated, these vials of nicotine, you're not real sure. I mean, they tell you what's on the vial, but I mean, it's how do you know? I
If
mean,
they're not regulated, then they don't have to.
Right. And there can be up to 500 milligrams of nicotine in one of these vials that may be with no child cap locks, that may be flavored like bubblegum or chocolate or peppermint, that might have a pretty label on it that a kid could get hold of. And you know what? If you drank it, if I drank it, because, I mean, we wouldn't, but maybe a
Right.
child would, and you know what? That it would kill him.
Wow.
Yeah, I mean, 10 milligrams can kill you if you drink it straight. 500 milligrams. So, I mean, we're on the right road. Forward thinking of our state, and just be well informed before you use. It's electronic cigarettes are not nicotine replacement therapy. I mean, there's plenty of NRT, nicotine replacement therapy, out there in the patches and the gum and the lozenges that are regulated. E-cigarettes or electronic cigarettes are not.
Interesting. Very interesting. Okay. What else do you all do over there?
Well, I think we have to. Our home health. We have a nonprofit. Right, we're unique in that we're a nonprofit home health agency, and just have a wonderful cadre of nurses, professional staff, OTs, PTs that we contract with, that will go into your home and provide some stellar home health care should you be in need. Or be looking for a home health.
And what we talked about this last week, but for someone to come into your home, you have to not be able to
right.
get
you have
out
to not
in the
be able
community.
to qualify.
You're homebound.
You're homebound. That's a part of it. Yes.
Okay.
Yeah, and there's a lot of folks in that position, unfortunately.
Well, and if they've
That
been
need a little
sick
bit of
or
help.
they've been in the hospital or something like that, and they still need the physical therapy, the occupational therapy, and they cannot physically go there, you all come out and provide that to them.
Right. But I guess what I would say in wrapping up and closing is that we are your health district. We're here for our community. We are a community health district, very involved in assuring that we stay healthy and that we are making right choices. And there's a lot of things that we can do personally to stay healthy, but there's a lot of things that we can do as a community to set policies and healthy for healthy eating, for sidewalks so kids can walk, bike paths so people can bike safely. We have a great community here in North Idaho, and I'm thrilled to be with the health.
And you
district.
have locations in every one of the counties.
Right. We have an office in Bonners Ferry, one in Sandpoint, one in Kellogg, and one in St. Mary's, and of course our office here in Kootenai County, which is in Hayden.
And are there clinics associated with each one of those offices that people can walk in?
There are. We don't have necessarily clinics 5 days a week, but give us a call and we'll let you know when we do have services or staff available to meet your needs.
And when they come in, for example, you had mentioned about doing immunizations. Is that, you could go into the pediatrician and get your children
Right, right.
immunized. But is this less expensive to go through the health district, or?
That's a good question, Connie. Certainly, we encourage people to have a medical home and to stick with their primary care provider. Let me take it back to me when I was a young uninsured mom, just moving here with at the time a 2-month-old, and I'm a nurse. I knew she needed some vaccines. I didn't have a job at the time because I had, as I said, just gotten out of the military and just had a baby, so had no insurance. So I went to the health district, and all you pay at the health district for vaccines for children 18 and under is a small administration fee of $14. So there's no office visit fee associated with it.
So it is less expensive to go through the health district to do that.
It is.
I remember going way back when I was a child that they would announce, here at this location, they're going to be giving X shot. And my mother would take me there and, of course, con me into it and say there was going to be a clown there or something like that. To get my immunizations and my different shots. Do they still do things like that?
With clowns?
No, not. But where they will have.
We have we have some kindergarten roundups and different events. Just watch the newspaper or take a look at our website. And you brought up a good point, Connie. Our services in our clinic area are all on a sliding fee basis. We zero to the cost of our services dependent on income. So some of the things we offer are at no cost based on income eligibility.
So there's really no excuse.
There isn't.
Very interesting. Well, what is your website that people can find all of this information?
It is www.phd1.idaho.gov. I'll say that one more time. www.phd1.idaho.gov. And that's just a numeric 1, not spelled out.
And there's all kinds of information on there. If you want to volunteer, there's all the volunteer opportunities.
And all the telephone numbers if you want to get to a certain person.
Absolutely. Mm-hmm. And you all have events occasionally that you announce on there also.
Right,
that I've seen.
I think we have a shrine clinic coming up or going on today.
Very good, very good. And if they want more information, should they contact you, or who should they give a call to?
It depends on what kind of information that they're seeking. If they have a specific question for our environmental staff, have them call our environmental section, our clinical staff, and all those numbers are right on the website. And certainly, if people want to give me a call, I'm always happy to talk, as you can tell.
Well, you are very interesting. Like I said, I heard you speak a couple weeks ago at the Rotary Club. And the thing that really stuck in my mind was you all keep track of all the diseases. I guess I assumed somebody did that. I just didn't know who.
It's public health. It's something very unique to public health because that's we want to keep our public healthy.
It amazed me. And then when you talked about, your restaurant inspections, again, I knew somebody did that. I just wasn't sure who did that. And I found it really neat that I could go on, like you said, you want to go to a restaurant or, you've been to this restaurant and you think, oh, wow, I wonder how clean they were or if they, passed all their inspections. You can go on there and look and see exactly.
And Panhandle Health District, the way Idaho does public health is unique in that we do have the districts. A lot of other states they may have some cities and counties combined, a lot of them just have county health departments where a lot not as able maybe to get things done like we are when we combine our resources as we do in Idaho with our 7 health districts.
Very interesting. Well, it has been great talking with you.
Well, and Connie, with you. Thank you so much for inviting me.
Well, I appreciate it. And again, if you have any questions, you can call the health district. What is your main number over there?
You can dial and let me just give you, if you're interested in environmental health, it's 415-5220. If you are interested in family and community health clinical services, you can dial 415-5230. Home Health or Senior Companion, 415-5160.
Or even to volunteer for a senior
Or even to
companion.
volunteer. Or WIC, let me give you WIC's number
Okay.
too. 415-5130.
Well, I appreciate you being here. And please come back
Oh, I
and
will.
talk with us.
I will, absolutely.
Again, this is Connie Clark, and you've been on the Senior Moment. And I will speak with you again next week. Next week, we're going to have Barbara Smalley from St. Vincent de Paul. So we're going to talk about all the things that they provide over there. You have a good weekend.